Hi, come on in. Exhibitors are welcome and invited. Jason, come on in. Come on in. So good morning. I want to welcome everyone to the FSOMA Fall Conference 2010. Our theme and message this entire weekend is Get Up, Get Going, Get Successful. And several people will be addressing you today involving and on this topic. And I'll be rolling out various people as we go. We always start our conference reminding everyone of the FSOMA mission, which is to promote the profession of acupuncture and oriental medicine through clinical excellence, practitioner support, and freedom of public access. So, practitioner support and clinical excellence are absolutely going on this weekend through our CEU courses, networking with exhibitors, and networking with colleagues. But the freedom of public access is our main message as far as you will be explained. Grassroots is our focus and our 2-year, 5-year, and 10-year plan at FSOMA. I also have started the last few years introducing our program with a jingle I came up with a couple years ago that has stayed and stuck, that I think continues to be relevant. The courses are just the appetizers, and this was an article I wrote for our journal, I think about 3 years ago, and Marilyn Allen enjoyed it so much, she had Acupuncture Today contact me and received permission. So actually Acupuncture Today now owns the article, and it is available on their website if you're interested. And in that, I discuss the probably Latin, but I'm not sure where, root of conference is confer, which is to bring together. So FSOMA's emphasis is that the courses are merely appetizers. The main course is us all coming together physically, emotionally, and energetically. I'd like to jump into briefly, because as I mentioned, other people are going to, in their own way, from their own perspective, also talk about get up, get going, get successful, including Peggy Delara, who's actually the author of this phrase. She and I brainstormed a lot of ideas, and out of her mouth came this, and we all loved it. But what I want to do is to bring you back a year ago at this exact stage, this exact weekend, when we had a different title, which was Reaching Out, Getting Active. And this year's message flows from that message. So I'm going to very quickly zing, zing, zing through the most salient points of that message, merely to refresh you, to bring you into this year's continuation, and remind you that the audio of last year's general session is all available for free as MP3 downloads off the FSOMA website. So I would invite you to listen to at least the first 20 or 25 minutes when my opening talk was these points. There's a lot of things that FSOMA is doing and a lot of things FSOMA would like you all to do, but our key message, including this weekend, is we need individuals on your own, in your own time, in your own area, to contact your state legislators. Very simple introductions. This is no heavy duty. You don't even have to talk about FSOMA. You just have to talk about you're an acupuncturist, your constituent, and we need them to know that we exist. So, in essence, this is the biggest thing that we all can do for this profession, and essentially does not come with any price tag. So we want you to just look up on the internet your local legislators in your area by your zip code, your state. You've got House members and Senate members, and basically call them and say, hi, I'm Amy, I'm your constituent, I own a business down the street, I live down the street, I'd like 10 or 15 minutes of your time. It's that easy, and they will set up a time, their staff will set up a time. You go in, the legislator might give you an hour, they might give you 5 minutes. It doesn't matter, it's just a process you need to begin. And you can keep it even about yourself in your own practice. That will help the profession. If you'd like to discuss larger state-related issues, you're welcome to. But I don't want you to be intimidated that you must. And the key is that we're trying to get people to understand that this is very simple, not to be intimidated. It's actually very relaxing and enjoyable. So just think of it as you would be getting to know a neighbor if you were new in the area or they were new. This is who I am, this is what I do, and I'm your constituent. And I'd like you to know that acupuncture is a very viable profession, acupuncture and oriental medicine. Should you ever have any medical related issues, please feel free. Here's my card to call me. And if they run with it and talk to you for an hour, great. If they say, I've got another meeting, no problem. But this is the next step that the oriental medicine community in Florida needs to do. And this is directly from last year. This is the single-handed most important thing you can do, to increase knowledge of and support for the medicine of acupuncture and oriental medicine. The FSOMA board, we are doing this ourselves, but we can only do so much. This is the area that a group of 9, 10, 11 volunteers cannot do, and hundreds of individual acupuncturists spread all over the state can do. So if you recall and if you listen to last year's message, we need to do this now. You can't wait until there's a bill to be defeated or a bill that we're promoting and all of a sudden show up out of nowhere. Like Acu what? You know, I mean, we have to lay the groundwork. And legislators kind of love it when you come in without a heavy-duty agenda, when there isn't a bill that you're bugging them, and then you get to know them just like neighbors. I used the analogy last year, this hurricane analogy. You need help putting up shutters and you have 3 hours to go. You don't want to be meeting your neighbors for the first time, asking a very intense favor. So another thing you could do and can do, which is the next step, is to actually ask them or find people. You can ask FSOMA to give you names, or you can do it all on your own. People in your area that are running for office. This is a great way with 2 hours, 4 hours, 10 hours of your time. They know, you don't even have to come up with what to do. You just say, what can I do? And they will tell you where to go, what to do. And this is a great way to get to know them literally, side by side, personally. And get your local colleagues to do this. This afternoon, we are offering in the same room a grassroots course. And we unfortunately cannot offer Florida CEUs because that's against Florida state law. CEUs cannot be given for things that deal with business, which grassroots really isn't. But there are NCCAOM PDAs available. But I don't want that to discourage you. And it's not the sexiest name, you know, grassroots. We try to come up with something compelling. But this is the future. Grassroots is making or breaking opportunity for acupuncture and oriental medicine. The Mixons are the liveliest people on the planet. You will have a blast. You will learn a lot. And yay! No pressure, John, no pressure. But anyway, they are the masters of bringing small, unknown professions to the forefront, particularly through coalition building, which FSOMA is actively engaged in and continues to be and will continue to be. We're taking care of that, but grassroots efforts. And we specifically chose them 3 or 4 years ago for their dynamic ability to make grassroots real and fun and effective. So there's that. Just a one-sentence thing. This year there was a bill that the Mixons helped us with other associations cause to not move forward. It never made it through committee, so it didn't go far. But the point was all of FSOMA's coalition building of the last 3 years really paid off because there were other professions that didn't care, per se, about the PT bill and said, if the acupuncturists don't like it, we don't like it. And that was probably one reason it didn't progress. But we've been put on due notice that the Physical Therapy Association nationally and trickling down into states intends to introduce something called dry needling into their Practice Act nationwide. This could be the next 10 years easily of what FSOMA has to deal with, and we will need your help. Could be 20 years. So we dodged a bullet this year. We had a nice little trial on reaching out and communicating and working with others, and it's only going to come back. So this grassroots work we're asking you to do, don't even say, what's dry needling? Doesn't matter. When you make relationships with legislators, and then we say, help, there's a bill, and here's the number, and here's the message, you're not a stranger to your legislator. And this is this homework we want to do in advance, okay? So basically the thing is that they call it dry needling, but it's acupuncture. So our argument is you can call it anything you want. It's part of our Practice Act, and it is not part of yours, and it requires a lot of training. Okay, fun stuff here. I would like to introduce your board of directors. Obviously, I'm Amy Sear. I'm your president, and I'm the chair of the conference committee. So this is why you see me doing many different things today. I'd like to introduce Annie Sturman. Stand up. Annie is actually kind of a co-chair. I apologize to Kim in a minute. Kim is actually the chair. That's a typo. but Annie is the co-chair and the exiting chair of the committee. John Barnett is our treasurer. And the chair of the budget committee, and has done a really marvelous job. Financially, FSOMA is in extraordinary condition. We are the envy of the nation. Ellen Teeter. Ellen is our secretary, and she is the person, I don't have a journal on me, that is a phenomenal editor of our journal. And if you haven't noticed in the last 4 to 5 years that she's been doing that, it's a significant publication. And Ellen has been nominated and has gone through the full approval process to become a candidate for vice president this year. Yes. Nedra Hyde. There's Nedra. Nedra is chair of the ethics committee. The ethics committee is kind of one of these behind-the-scenes committee that is basically ready to go if they're asked to determine an ethical viewpoint or handle some sort of ethical accusation, or should the board say, what's the ethics committee think of this thing we want to do or not do? Rodney Dunetz. And Rodney is on the ethics committee as well as the conference committee. And this year, we've really had a significant stepping up of people on committees, so I apologize to many of you who are on a lot of committees and is not noted here. Peggy DeLara. Peggy is a board member. She is the chair of the bylaws committee. She is the bylaws committee. She is on the publication committee with Ellen and is doing great things. And she too has been nominated and gone through a full, we interview people. This is a highly vetted process in order to become a candidate. Candidate is different than a nominee, and the candidate is who goes on the ballot. So we have introduced a pretty strict vetting process about 2 or 3 years ago. And Peggy is candidate for president. And he has my full endorsement in case anyone wants to know. I am thrilled that she has stepped up as my replacement. And she has been in training, whether she knows it or not, for a year. Okay, Kim Black-Caporel. She is an alternate board member. She's the chair of the membership committee, and she too has gone through the full vetting process and is candidate for secretary. Kate Hoffman is an alternate board member and serves on the publication and conference committees. and is in training as an audio technologist for FSOMA. Michelle O'Shaughnessy. Michelle is an alternate board member and is the chair of the nominations committee. She served on several other committees, but she's the chair of the nomination committee. All of you should have received the call for nominations. It is also available on the FSOMA website, and we have extra copies. There are board positions open still for nomination, and nominations conclude September 3rd. And she's the gal, and this registration nook out here is a home base for the board to be accessible to all of you, particularly members, but it doesn't matter, to answer any questions about membership or anything. And Michelle will be spending a significant amount of time there should you have any questions relating to the nominations process. I'd like to introduce the FSOMA office. I see Kathy. There's Lori. So Lori Davis has been our executive director since 2006, continually growing with FSOMA, doing a dynamic job in our office. And we are constantly sending more responsibility and more work her way. Kathy Groh-Tomasi. For Lori, but is in charge of all operations and bears the title and responsibility Director of Operations. And I'd like to ask everyone, you sort of already did, but to please thank both Kathy and Lori for very significant work, including last year having fun. They didn't know this slide was Now I'm going to introduce you, some of these folks will come up later, but let me introduce you to our main players, both for FSOMA as well as a certain percentage of people here. Corinne is here, correct? There she is. So I didn't have a photo of Corinne, but Pat, John, and Corinne Mixon are our endeared lobbyists since I think we're on our 3rd year. We are extraordinarily happy with them. I believe that they are happy with us. John Nixon is going to come up, and Pat, you're welcome to come up with him if you'd like, to address you later, and also to introduce our keynote speaker. Thank you, Karen. Marilyn. Marilyn has to come up here. So she doesn't know this wasn't prepared, but we have sort of a treat for Marilyn. But before I do that, let's get her up here and embarrass her a lot. Yeah. Of course, you all know she's part of the American Acupuncture Council and Acupuncture Today. But I know, very significant this year is ICD-11 codes, which I do not have time to go into. What's going to happen is it will be explained to you tomorrow. The FSOMA board is having a basically special dinner. Because Marilyn is approaching the board for financing and for signing on to an international scope project that we consider, I call make or break, she calls it once in a lifetime. So after this evening, I will be better able, as will the rest of the board, to really articulate or perhaps answer questions. So we are going to go into your classrooms and interrupt your classes for a few minutes tomorrow because I felt, one, I'm going to know a little bit more. I actually, for full disclosure purposes, need to tell you that I was invited by Marilyn to be on a national task force of this project. So I know a fair amount. I know probably as much as anyone but Marilyn knows. But tomorrow we'll be able to say, you know, FSOMA made the decision to do blank, and what any particular roles. But what this basically is in a really quick nutshell is the World Health Organization is working on diagnostic codes into the ICD-11, which is the next step for the U.S. The U.S. is jumping over 10, with our medicine as diagnoses. This is the biggest possible explosive opportunity as far as I'm concerned, number one, with it, and without it, it could literally cripple us if we are not, if our medicine is not in those codes. And many, many ways. It doesn't take a lot of thought to figure that out. But there's $300,000 is required. The World Health Organization, am I correct? The World Health Organization will do all the work, but they need the U.S. collectively to say, yes, we collectively support this, and we collectively, over a 4-year period of time, commit to totality $300,000. So FSOMA will be having a significant conversation on how we can participate financially. But most important, and why I brought Marilyn up here, is we have something special for her, which is a special ribbon that you didn't know about. You need a name tag that says Acupuncture Ambassador. Yeah. Yay! I used to call her the Oprah Winfrey of Oriental medicine, and she liked it, but that's not really applicable. Marilyn has spent 5 or 6 years, her own money, flying herself to Geneva, Switzerland, as well as to Asia, all over Asia, working to create those codes, and those are already done, and she worked with all the nations of the Pacific Rim, led by the Pacific Rim component of the World Health Organization, all on her own. She's more passionate about promoting our medicine than most or all of us are. And therefore, you're our Acupuncture Ambassador. Thank you. Thank you. Just real quick.
One of the things we have to have for ICD-11, other than the support of the profession, is government support. Now that means somebody from the government in Washington, D.C. And I met with them about 4 weeks ago. NIH, the CDC, and NCAM, and they all support it. They all know that they need this medicine. And so I'm
took it upon herself. We need government support, and she got herself to D.C., paid her way, and had those meetings. So thank you. It's perfect. Now we need your name badge to hang it on. Okay.
Want some help?
Yes. Because she's an ambassador. Okay. Reminder. Conference next year, right here, same weekend, August 26th through 28th. Okay?